Thunder Bay Rainy River Member of Parliament Marcus Powlowski joins NetNewsLedger to talk about challenge testing for COVID-19. It's James, and we're in the NetNewsLedger studio with Marcus Powlowski, who's the Member of Parliament for Thunder Bay Rainy River. Marcus, welcome.
Hello, James. Glad to see you in your new place of business here.
We had to do a shift because the grandkids who stay with Amanda and I were starting to get too into the news. And so it forced us to do more work. And when you're 5 years old, I'm not sure if our readers and viewers wanted to see 5-year-old perspective news.
Well, it's the same in the House of Parliament. So everybody's at home on their Zoom meetings and things. So kids wander in and out. Some people have some weird things. Like one member of Parliament has his bookcase behind him, and his wife has color-coded the books so that there's orange books here and then red books and then blue books.
Maybe a little, what is that, obsessive?
Yeah, a little.
Now, we wanted to, you were telling me about vaccine testing. What do our readers and viewers need to know, Marcus?
So I wanted to talk about something called challenge trials. I don't think there is a more important issue in our society right now than getting a vaccine out. Now, I guess equally important would be finding a cure.
Yes.
For COVID. Certainly it's likely and possibly we'll come up with drugs which would be effective at treating it. Okay, but an absolute cure, that's a little more difficult. Really, the magic bullet for 90% of our society's problems right now is to get a vaccine.
Yes.
and distribute and vaccinate people, so we no longer have to worry about all these things, the border closing, our kids now going back to school and worried about spread of it, restaurant owners losing money because they're not having the same number of clients. Almost our national debt now being over $1 trillion. Globally, we're probably going on close to a million deaths in places like South Africa, Kenya, doctors walking off the job because they don't have, and nurses because they don't have enough PPEs. So this is a problem for every country in the world, and it's totally absorbed all of our efforts. It's absorbed all of our news. I don't know about you. There's starting to be a few more stories, but it gets really tiresome when all you listen to on TV is COVID, COVID, COVID. So there is a solution, there is a magic bullet, and that's getting a vaccine. Now, there are 150 vaccines that are in the process of being developed. There are 3 phases in developing a vaccine. Phase 1, which are animal trials. Phase 2, where you give people a vaccine, a small number of people, and see if they have an adverse effect. Phase 3, conventionally done, you take a whole bunch of people, i.e. like thousands of people, you give them the vaccine, you give another thousands of people a sham vaccine, a shot of water.
Yes.
And then in the course of their everyday, they're exposed to the virus, they're not exposed to the virus, and you look over time to see if there's a significant difference between the vaccinated group and the people who didn't get the vaccine. Now, there are currently, of the 150 vaccines out there, there are 10 in phase 3. Now, some of them may turn out, one of them, maybe a few of them will turn out to be effective, but most vaccines don't work.
Okay.
So it may be that none of these are effective, in which case then we have to go through phase 3 trials again. So this could conceivably take quite a bit of time to do. Now, there is a way to speed up the process, and that's something called challenge trials. So challenge trials, and this has historically been done quite a bit with all kinds of other infectious diseases. With a challenge trial, you give a bunch of people the vaccine, and then you actively try to infect them. So you stick some coronavirus up their nose. Now, people are going to say, what, are you crazy? Are you nuts? Well, no, not really. Well, maybe some people think I am, but other than my wife, most people don't. But the whole kind of secret why this makes a lot of sense is because in a certain population, and that's young people, young healthy people aged 18 to 25, the virus really isn't nearly as worrisome as it is in older people or people with underlying health problems. In fact, in that age group, age 18 to 25, COVID-19 is no more serious a disease than regular influenza. Now, we have done these same challenge trials with regular influenza for quite a while.
Like the flu shots.
Yeah, to develop the flu shots and develop treatment for Tamiflu. Ostemivir came through, and I think that went through a similar kind of challenge trial. That's my understanding. So in this population, and if you look at the statistics, the BBC did a story on this, and they were reporting from the numbers they were given, the likelihood of death if you get COVID-19, if you're young and healthy and age 18 to 25, is about 1 in 40,000. So within this population, there isn't a big risk. There is a risk. It's not zero, but there isn't a big risk. The other thing is the numbers that you would need in order to do a challenge trial to get an idea whether a vaccine worked or not. The numbers I'm hearing is like 40 to 50 people potentially. So you take 40 to 50 people with a 1 in 40,000 chance of death, the risk is pretty low. Now you compare that to the benefits. We get a vaccine out there and we're saving potentially millions of lives globally, plus obviously doing a lot to really turn our economy around and alleviate all the economic suffering. And that million deaths, that's the people dying from COVID-19.
Yes.
That doesn't include all the people that may be dying because the hospitals are closed down because nobody wants to go there because of COVID-19. People aren't getting their elective procedures done. People aren't getting their screening, their colonoscopies and stuff done for cancer. And that doesn't include, and they're predicting, like as a result of this, increased poverty in developing countries, possibly food shortages and things like that, which just adds to the burden. So you look at all this and you say, compare all those consequences to the small possibility that it would cause serious adverse effects or death in this population. And the other thing I didn't mention, the only people that do this would be young volunteers. Volunteers, and globally there's like over 40,000 people who've already signed up to something called One Day Sooner, and that's kind of where I heard about this. 40,000 young people and intelligent. The guy who started was like Harvard Law graduate, but they've already signed up and from about 140 countries.
So this is something that is being, almost sounds like it's coming virally, internet-wise.
Yeah, and it has, and apparently last I heard there were 1,200 people in Canada who'd signed up. The CBC did a 10-minute piece on the National on it, and they talked to a bunch of young people, and you know, good for them. They're young people who had heard about this, who thought about this, who thought about the risks, and said, you know, why not? I want to do something for my society to make it a better place.
I was listening to the Premier on his daily press conference, and he's talking about young people who, for the most part, he said, you know, most people are being pretty sensible about this. And you see it in Thunder Bay. There's not been any huge parties. You know, Northwestern Ontario has become its own little zone with almost no COVID-19. But he was talking about huge parties happening and huge gatherings in Toronto and in Brampton. And the young people seem to almost be treating this like it doesn't matter. So it's so positive to hear that there's young people saying, okay, hey, I'd like to step up and help.
And you're absolutely right, and that's an added reason to advocate for these, because a lot of young people realize people are partying and things. In fact, I've been told of people, very well educated people, medical people, young people, who are having COVID parties. They want to get COVID and get further down the road to herd immunity, because they realize in young people the risk is low. But I think if you look at the spread has been in a younger population, in various parts of the world, whether Canada, the United States, because I think a lot of young people realize that for them, the risk isn't that high. So these are the same people, okay, you're ready, you're not too worried about it, you want to do something for your country, for your community. Maybe you have people in your family who suffer from chronic disease, elderly, who you'd like to help in kind of contributing to finding a vaccine. So that's kind of, in my mind, if people are going to do it anyways, like deliberately do things that they don't care if they're exposed,
make it a benefit.
Yeah, and they're willing to do it, and they get paid a little. I mean, you don't pay them enough that it's going to make poor people want to line up and do it, but I mean, they get a little bit of money. They probably get a month off work while they do it, get paid for it, and you do the world a real significant, give them a real significant benefit.
Well, I know early on when this started, one of my first interviews with Minister of Health Haju, the member for Thunder Bay Superior North, we all watched this start to happen. And I don't think any of us really believed, 2020, if you'd have sat on January 1st and said, well, in 2 months, the whole country's going to be shut down for 6 months or longer, nobody would have believed you.
Yeah.
And so now we sit with, how do we solve the problem? And, we've even had people denying that there's any, there's all kinds of market out there with people believing all kinds of things. I appreciate you coming in to share this idea, and let's get it out there. And
let me just add one thing, because people say, well, it's unethical because what happens if someone gets sick and dies from it? Well, what about policemen or policewomen? They, in their everyday lives, face threats. How about policemen and women? There's volunteer police or firefighters.
Yes.
They put their lives at risk. And if you're a fireman, firewoman going into a burning building, your risk is way the heck higher than 1 in 40,000. How about the Army? I mean, if you think it's unethical to ask people for the sake of society to take on some risk, then the Army's really damn unethical to allow people to go into the Army. How about healthcare workers? There's been globally 7,000 deaths of healthcare workers. We're asking them to put themselves at risk. So, I think it's a little arbitrary in my mind to say, oh, it's unethical to allow them to assume a risk like that. Well, I think it's unethical to not do it. I think there are volunteers who want to do this. There are vaccine makers who want to do this. The only thing stopping anyone doing this globally is this reluctance to do them because it's unethical. But I think those people who are actively saying, no, it's unethical, we won't do them, and as a result of that, it delays getting out a vaccine. Now, if one of the ones in phase 3 work, then okay, finished. The story's finished. Let's go with that. Yep. Let's get it done. But if they don't, and there's a delay in developing a vaccine, I think those who say it's unethical, who aren't willing to do this, they ought to accept that they bear some responsibility for thousands of deaths globally and all the economic harm because their actions or inactions prevented us getting to a vaccine sooner.
It's interesting, Marcus. I've heard this described by the Premier. I've heard it described we're in a war against COVID-19. And, in the United States where they're approaching 200,000 deaths, I'm old enough, you're probably old enough to remember people on the streets protesting the Vietnam War. Get out of there because there was 58,000 soldiers who were killed in Vietnam. And we're approaching, almost 4 times that number in the United States. And people are in the streets demanding everything but solving the problem. Yeah. And so, moving forward on this, I think that's something that we should have a national discussion on.
Absolutely. So thanks James, for being
coming.
Part of the discussion.
Thank you.
Nice talking to you.
And we're good. Stay informed and stay up to date. Hit subscribe, hit like, share this with a friend. Make sure you hit the little bell so you get notified the next time that we have a video up. Thanks for tuning in to NetNewsLedger.